in dentistry is no more accepted dirty clinic. No more, finish. You have, and I will show you from where you start and how to finish. You see, in this clinic, we don't accept another patient till she clean everything. Everything should be disposable. Now, the clinic, especially the dentist, we are receiving disease and we are giving disease also. So once we protect ourselves, we will protect the patient will protect the community, and like that. Be careful with needle, don't pick yourself. You don't know the patient what disease have. Many patients, they come, they are lying. You ask what problem, what disease you have. Either he doesn't know, or he try to lie. Why? In my experience, I extracted for a patient a tooth. He bleeded for 3 days, no stopping. So immediately, either he have iron blood problem, vessels problem, or will have diabetic or blood cancer, leukemia, HIV, everything could be. So we did blood investigation for him. 500 it came the milligram the blood sugar. It's not acceptable. Then I told him, you have blood sugar, this is not new. He told me, doctor, I went to many doctors, I told them to extract, nobody extracted for me. So he didn't, he lied, you see. I told him, you may die on the dental because he may fall in coma, you see, if the blood pressure comes too much up. Then we try to control his blood sugar. We give him high dose of antibiotics. We sutured again, and we put collagen inside to stop bleeding. All right. So don't trust always about the patient. Some patient, they don't want you to know what they have also. So the continent. Now what we are going to speak is the mode of transmission, how the disease will be transferred, the mode of infection control, how you control it, the objective, why we have to control, operatory aseptics, the doctors, how should be sterilized, sterile, personal protection barrier, the sterilization, the disinfection, laboratory infection control, clinical waste disposable. All this dirt is now we extracted should go to safe place. We cannot throw it here.
Yeah.
It should have a box. They have in Europe a car come every month or every week. There is a box special. They take that one and they put in a special environment, not to control infection. All right. Here in Yerevan, in Armenia, I saw many times they come to the clinic from oral health and they take swab from here. Suddenly they will come anytime. They will come and take swab. If they find in the culture there is a bacteria, I don't know. We don't have till now any problem, but I don't know what is the procedure. So it's important. If this is called infection control. Infection control, also called exposure control plan by oral health, is a required office program that is designed to protect personnel against risk of exposure to infection. Sterilization, تعقيم. We have physical or chemical procedure to destroy all microorganisms, including substantial number of resistant bacteria spores. Nowadays, the bacteria is becoming resistant. Why? Because the people are taking antibiotics continuously without prescription, and like somebody, you give him chlorhexidine for 1 month, mouthwash, then you want to do sterilization for the oral cavity, the mouthwash, the bacteria is used. تعمل محفظة البكتيريا. It will be surrounded by membrane and will not let the antibiotic go inside. It will be resistant. So this is need good sterilization to control the infection. Sterilization mean the destruction all life forms. Okay, sterilization is the process of killing or removing all available organism. Okay, you have to kill, not only just stop it. It will grow again. free from all living microorganisms, usually describe example the probability of a surviving micro being in 1 million. If you sterilize even that, one of them, one bacteria could be regrow again. Destruction, disinfection, it's mean destruction all pathologic الجراثيم الممرضة and other kinds of microorganisms by physical or chemical means. Okay. Disinfection is less lethal than sterilization. Disinfection is not enough. Disinfection, it's mean you put this instrument inside a chemical and you give it to the doctor to work. This is not, you didn't kill the bacteria. It always should go for sterilization. Now we'll speak about sterilization later. So disinfection, التعقيم يعني التعقيم بنوا أو الطهارة بيسموها التطهير. It's not enough because it destroyed the majority of organism pathogenic microorganisms, but not necessarily all the microbial form. Bacterial spores is not died with disinfection. Disinfection is a process of removing or killing most but not all viable organisms. مو الكل تقتلهم. All right. So disinfectant, chemical agent. This is spray we are using here, the tables and things like that. On inanimate object to destroy virtually all the recognized pathologies, microorganisms, but not necessarily all the microbes. Okay, so the chemical will not also is not enough also. Asepsis, تعقيم, prevention of microbial contamination, leaving tissue or sterile materials, excluding remove or killing microorganisms. Please, you read this all. You read it slowly.
Yeah.
Mode of disease transmission. How the disease will be transmitted. Direct contact with blood or body fluid. Any job you are doing with blood, it needs complete control for infection. Indirect things like you are doing examination, oral examination or things like that. We are putting mirrors and things like that. It's not need high risk control. All right. But any working with blood, it's need good sterilization. Indirect contact with a contaminated instrument or surface. You understand mode of disease transmission, how the disease is gone, is transmitted to somebody. تنتقل من شخص لشخص بالبلد الفلويد منطقة موبوءة somewhere which is contaminated and you touch it. Contact of oral mucosa, مثلا you finished, all right? You put your eye finger on your eye with a contaminated finger, the infection will go to your eye. Or you put in the ear or nose or whatever be, you will spread the infection. Or you touch here, inhalation of airborne microorganism. حتى التوربين هذا اللي عم نشتغل فيه, if the turbine air which inside and water, if the microorganism go inside, you made the air which is coming out, it may send the microbe to the oral cavity. So this is the circle of infection, the chain of infection. Start infection as agent, الخزان reservoir, portal of exit, الحامل الناقل, means of transmission, وسيطة النقل, portal of entry, منين بتدخل؟ عن طريق الدايجستيف، عن طريق البلد، عن طريق النوز، عن طريق اللنجز. اوكي. susceptible host العضو المستقبل او العضو المضيف، the guest, the organism which is accepting this to live inside him here. So objective of infection control is to reduce, implement, simplify, يبسط and protect. This is the aim of infection control. This circle I want you to study well. Okay. How you start? بنخفف بننفذ, simplify, simple and protect, and we protect ourselves. Why, who and what? Why is infection control necessary in dentistry? Why? The dental staff and patient may be exposed to a wide variety of pathogenic organisms. نحن معرضين والمرضى لجميع أنواع الميكروبات الموجودة في العالم. Who is responsible for infection control in dental office? مين المسؤول؟ مو الدكتور ولا الممرض ولا شيء. All the team who is working in health clinic should have been vaccinated nicely against hepatitis B. He should have control, blood control always. Be careful not to pick yourself. All this, each member of dental team must follow recommended guidelines. There is infection control program. If you ask the Google, he will give you the infection control. This is very essential in Europe. Two things they are afraid in Europe. One is the tax collector and the next the health control. هدول الشخصين بيخافوا منهم في أوروبا. ماشي؟ لا اللي بيجي بياخذ ضرائب
tax collector.
tax who tax and the next is the health. If he enter the clinic, the doctors come because they may close the clinic. You see? There is no joke in this.
Sue the doctor,
Yeah. What should be done to prevent the transmission of disease in the dental office? What should be done? The most effective to prevent hand washing before and after. Once you enter your clinic, wash your hand. Once you finish working, wash your hand. Don't say, I am wearing a gloves, no need. No, sometimes the gloves is penetrated, like now, the bacteria will go inside and do it. Gloves, face mask, protective eyewear. There is protective glasses you have to wear because the bacteria may go inside the eye and go inside the circulation. Protective clothes you wear when we are doing surgery. We are wearing protective clothes. Instruments sterilization and disinfection is very important. Always the instrument will be disinfected first. We clean all the blood and things like that. After that, we put in sterilization. All right. This is the way of working. Which disease is transmitted in dental office? We have the dental should have an infection control program to prevent the transmission of disease from the following: patient to dental team. المريض بيعطينا. Dental team to the patient. Patient to patient من مريض لمريض. Dental office to community. من هالعيادة موبوءة عم تزرع مثل واحد ببيع لحمة فاسدة مثلا. He is distributing infection in the area to the dental team family. Community to dental office to dental office to patient.
From the outside
Okay? To prevent such infection, كيف نمنع نحن الانفكشن? Following is a list of all those procedures and precautions that together consist infection control. هلا هندخل بليست. This guideline should be followed each time treatment is performed because we are never certain of patient status. نحن ما بنعرف شو وضعه الصحي لهالمريض ولا بأي ممكن. Either because لأنه هو ما خبرنا أو عم يخبي علينا أو هو ما بيعرف. He doesn't know what is his health condition. Or he know and he doesn't want us to know. Following this guideline, every patient is called a standard precaution. Standard precaution, immunization, لقاح, vaccination, especially anti-hepatitis B. We take it 3 times. First months we take 1 injection, should be given in the muscle. After 2 months we take the second. After 6 months we take the booster, and we do blood test. If it came hepatitis B surface antigen, we have antibodies. That means we are good under. After maybe few years, nowadays they say enough. If you have vaccinated 1 time in life, you have antibodies. Some schools they say no, we have to be vaccinated after few years. Before they vaccinate, they give us a booster. We do blood culture and we see blood test and we see if we have antibodies and how much. Is it strong or it is minimum or it is less? If it is down, then we have to take another booster. Okay? Patient screening. We have to know about his health care, and if we are suspecting, you do send him for a blood test. Hand washing, barrier technique, like we use the rubber dam when you are working, then the air, the water and things like that will not come down. تعرفوا الرابر دام هو البلاستيك اللي بنحطه بنخلي بس السن. We only leave the tooth for treat. The rubber that we put. That one will protect you during working. This is the rubber dam. Pre-procedure, you do rinsing, personal protective equipment, needle, sharp instruments, safely, occupation. The needle and the sharp instruments, the knife and things like that should go in a special box. Not you throw it here because anybody after may pick himself. Occupational exposure to blood, bloody fluid. Instruments, sterilization and disinfection should be sterilized. Surface, this is the surface. Disinfection. Radiographic, this is the radiographic. You see when I take X-ray, she put in a plastic cap and we take it out. Laboratory asepsis and infection, dental waste management and disposable. كل الشغلات everything we throw it should be in a proper place. Personal equipment. منظمة الصحة العالمية Oral Health Organization required the employer to provide employees with appropriate personal protective equipment. Example, protective clothes, surgical mask, face shields, protective eyewear, حكينا عنهم, disposable patient, heavy duty utility gloves. These gloves which are wearing for examination, it is not acceptable for surgery because it is thin and it is not sterilized and may tear out. So the surgical gloves are more thick and sterilized also. All right. Performing tasks that could produce splash, any contact with body fluid, perforation. Okay. Hand hygiene, you have to wash it. The washing way in surgery is like this, like this, like this, like this. All after you take a brush with your needles inside, from here you give time about 1 to 2 minutes washing. This is the way of sterilization your hand. Hand washing is required after you touch any contaminated area. We should always use liquid swab. This is the liquid swab, okay? Antibacterial. Don't use the sabun عادي, the solid one, because this one transmits disease that will be stay inside. It's a simple things, but it's important. And always when you are washing your hand, this one, don't use this one like this. When you finish, usually we do like this, okay? And you raise your hand. After you will, why? Because I don't want the water again come here. We enter the operation room, our hand is like this. The nurse will give us wear up. First we'll dry our hand, we wear gloves, and we start working. Before and after patient treatment, before gloves placement, always before you wear gloves, you have to wash your hand nicely. In dental operatory environment, face exam, surface equipment, contact patient. Okay. Okay, you read this things like that. Let me go first. Infection control during the pre-treatment period, the process. Look, if you look now, the nurse asked me what you are going to do, doctor. I will tell her I have endodontic work. That's mean she knows that she have to prepare for me hypochlorite, the sodium, the needles, the things like that. She knows the procedure. Don't take all instrument on the table. Only whatever you are going to use it. Okay. I don't want infection to be distributed to other instruments. This what he want. Only remove the necessary items. You use it to facilitate your work. Don't take everything out. Pre-plan the materials needed during treatment. You tell him now. She asked me what we have. I told her at 3 o'clock I have implant. Then she told me please give me 30 minutes to disinfect the clinic and prepare the instrument. All right. So don't take all instruments that we need put on the table and things like that. Just you prepare only the necessary what you are going to do. Utilize the disposable items. You see now we are using the suction which is disposable, the oral disposable one time, everything disposable, and you clean it. Use pre-arranged tray. You see the tray صينية is all sterilized for one patient, and you send it back. Every patient have to have his own instruments. Even the burrs which are using to نحفر الأسنان فيها, they become in a metal single use. You use it and again you send it for sterilization, but we don't prefer to use this one, second patient use this one, okay? We are doing mistake, but because if I touch it by hand, may I distribute infection to other birds, all right? The second patient will be contaminated. This is the rubber dam, I told you. The teeth is only exposed, he is working, and this one is the barrier holding. This is nitrous oxide, the gas is putting on the nose. بيسموه الغاز المضحك, laughing gas. Nitrous oxide will give relax to the patient. And once you stop it, he will wake up again. He is not completely sedated, but he feel happy. مثل الفاليوم, he be relaxed. Okay, this needs a special course. I have it in my clinic. This needs a special course to use it. It's good for children and for patient. Like this patient now we extracted. She was the first time she came, she was trembling. This gas is perfect in her case. All right. You have to know which instrument is the most contaminated. Like now, I use the forceps and like that, like things like that. You keep it in safe places. This is extremely. If a patient HIV or something like, or hepatitis, or he is immune deficiency or whatever be, he had transmitted disease. This is the way you control your chair and things like that. After you throw it and out, okay? This is highly dangerous patient you accept in your clinic. This is also, you see the hands in surgery, in operation rooms, the head also is all covered. When I do implant, I do it like this, the clinic. All the instrument is covered with a sterile things like. See, even this one, all is covered by even I push the buttons to sleep the patient or things like that. The air, the suction, all are. This is disposable. This is all is covered. Everything should be one time. You take it out and finish. All right. You have to write everything you did. Sterilization. This one is sterilized. This one is not sterilized. You have to document everything you did. This is not your work, but it's the nursing work, the oral hygienist and things like that. They have to write all these things. What if you sterilize anything? It is written the date of sterilization, the time of sterilization. In the sterilization area, there is a paper that once it is sterilized, then will show you red color before it is yellow. After the sterilization, will show you red color. That's mean sterilized, and you have to write the date of sterilization and the time, because this red may be changed to green later. It's mean this infection is finished. You have to open and do again sterilization. So this is the operation, the head cover, and this is the gloves. She is ready for surgery. This is the gloves. Your head always you don't touch. This is sterile gloves for surgery. This is the different from other ones. You don't put your hands in your pockets when you are working. Infection during period, chairside infection control. See, this is another kind of mask. This is for the X-ray. If you want to take X-ray, they are covering it with nylon. You see, even the mouse I am using should be covered also. The keyboard also should be covered. All this need infection control. You see, don't like this. It's not acceptable. Your hand is blood and you put your on the mask. You see, or your glasses, or you do a telephone call. or you write, be careful, all this is not acceptable by health, and it's not acceptable by the patient also, because he is controlling you when you are working. Educated patient, he is controlling any step you are doing in your clinic. This is the chair, all should be used. There is now in the market sprays. We have it. You spray this one, it will kill even the HIV infection in 1-2 seconds. It will kill it. It's available in the market. Chemical. That one you use it for all these tables and trays and things like that. But it's not for the surgical instrument. It should go for sterilization. This instrument we use it for surgery. It should be very well. It's critical and semi-critical and non-critical. بتوزعون. The surgical is critical. The semi-critical مثل mirrors, things like that. Non-critical is the mouse and things like that. Okay, this is the non-critical. Sterilization, always the instrument will show there is a packet, they fix it and they put in the autoclave. The autoclave رطب يعني. Autoclave is a machine which control infection, is the only one kill bacteria. No one can kill, only the autoclave. Now we can go and see it. I will show you. This work by رطب يعني humidity. It will kill, and pressure. This both kill the bacteria. We have ovens like dry heat. That one will not kill totally. It's good for metal sawani, things like that. You can use it. Okay. Bukhar, heat, wet bukhar. Agent used in sterilization. يعني sunlight, drying, most heat is the autoclave, filtration, radiation. Some they use radiation, ultrasonic and sonic vibration. Ultrasonic دائما any instrument with blood or something after washing and cleaning we have to put in ultrasonic. Ultrasonic have chemical liquid inside. By vibration بالاهتزازات it will take all the bacteria which is still on the instrument and come down, and every 3-4 days need to be changed according to the company. This is the called chemical agent مثل alcohol, aldehyde, formaldehyde مستعملة في التحنيط تقتل الجراثيم, kill the bacteria. Halogens, phenol camphor, this is all toxic materials. Surface active agent, metallic salts, gases مثل ethylene oxide, formaldehyde, this is all toxic agents. Some companies they stop it because it's causing cancer, especially the formaldehyde or things like that. We have instruments that we cannot sterilize it in chemical or whatever then we are using tablet, ethylene, chlorethylene. Okay, will come tablet you put inside and you cover. That tablet will produce gas. This gas will kill the microbes. Okay, but one side effect is that may cause cancer. This is the reason it's not accepted much in the market. The 4 aspect accepted method of sterilization is the steam, the autoclave. This is number 1. The next one is the chemoclave sterilization, the dry heat. There is no before we were using dry heat. Ethanol oxide sterilization. This is the ethanol الحبة اللي قلت لكم عنه بتحطوها this is the tablet you put and it will produce gas. This is the autoclave before. Now it is changed مثل البريستو, ضغط اللي بيستخدموا الضغط, pressure and weight. Before this was till now it's available, but this is for small things, not fast. You want to do 20 minutes, but always you remember it's required 121 centigrade pressure and 15 minutes, 15 libos. This is accepted to kill bacteria in control. What is the advantage of autoclave? It is fast, effective, and you can pack the towels you put inside. But if we put a packed towel in a dry heat, هتحترق. Okay? The disadvantage, items sensitive to heat, you cannot sterilize. You cannot sterilize. It tends to correlate carbon steel burrs. إذا حطينا سنابل burrs, it will come black because it is wet. فيها رطوبة. بس في الدراي ما تغيرش, will not change the color. Chemically, operate كما centigrade. They have a circle time. Each one medicine there is written over and advantage and disadvantage. Okay, this one is this is the dry heat. Yes, this is taqim dry heat, like this. Before it was like this. Yes. Now this is the dry heat, please. All right. Okay. This is the dry heat. صواني بتحطهم تفتح الحرارة حوالي 160 درجة 1 hour.
Yes, inşallah daha sonra
Yeah, Turkish linker. This one is the ethanol oxide sterilization. This is the advantage and disadvantage. You read, please. We'll continue coming time. Okay. This is the one is using.
Doctor, we have to do the sterilization every week or every month.
What?
The sterilization.
Once you have instrument not enough, you have to do your sterilization. We are doing 2 times daily sometimes here. Come, I will show you the sterilization. This here is my continue. You continue.
Ladies first.
You come please, but don't enter, just here, okay? See now, they wash all the instruments, after the sterilization, they put inside, and they close it, and they sterilize it. This is autoclave, they have 2 here. All instruments should be packed inside. This is a program.